this is being controlled not by hand or so through your head movement and through your breath. You can actually control the images as well as interact with the what's going over there. So there can be interactive uh, series which are running there, which can be animated features, or it could be something which the child is learning and he's enjoying himself. At the same time, you put the patient at ease. And this is a very, very cheap device. It's basically using cardboards. And here you can see the patient, the child is being easily, they're putting up a line there. And this time he didn't even wince. He was so engrossed in his area and in this. And in fact, it has such an interesting feature because when you're suspecting the child might move, you immediately increase the sensitivity of the VR, you can decrease the sensitivity of the VR.
So what I'll do is I'll just quickly begin while the attendees keep coming in and keep joining it.
Yeah.
Welcome to the Blue Circle. It's such a big privilege and pleasure to connect with everyone and our distinguished keynote speaker, who is handpicked because of the Think input and the rich experience he brings in. Thank you also to our distinguished audience for joining us, most of whom are CEOs, CXOs, and senior leaders. Many of them are our members and are repeat visitors to our webinars. This is very encouraging and motivates us to provide even higher levels of dialogue through the online mode as well. For those of you who are new with us today, Blue Circle is the world's first sector-specific networking app for business leaders that's built in India. We currently focus on 20 sector communities such as healthcare, e-mobility, renewable energy, real estate, and many more. We also present socioeconomic insights which ultimately determine the evolving complexion of the market. Along with our weekly webinar series and our digital publication, you will be happy to know that we have recently launched the first version of the Blue Circle app for leaders, somewhat like the sector-specific LinkedIn for senior leaders, a space to have meaningful conversations, connect with over 15,000 plus like-minded leaders from India and across the globe, house high-quality curated content, and access business opportunities across the sectors. Those leaders among you who are interested, please join us. I will share the link to the app in the chat section and will soon be sending out invitations to our new guests post today's discussion. Now, without further ado, I'm pleased to introduce today's keynote speaker, Dr. Mudit Saxena, MD and CEO of Currae Hospitals chain. Dr. Saxena has 22 years of experience in leadership roles in corporate, trust, and public sector healthcare organizations. He started his career serving at Rural Health Center in India. He held key positions with super specialty chain of hospitals like Wockhardt and Fortis Hospital, Bangalore. He was a COO with HCG Enterprises, the leading cancer chain of hospitals in India. He also served as Group CEO of Currae Hospitals, the 5th largest chain of hospitals in India. He served as the MD and CEO with Ovum Hospitals, a well-known chain of premium birthing hospitals in Bangalore. Dr. Saxena has also served as chairman at the Healthcare World Asia Conference, Singapore and UK India's Healthcare Summit at UK Parliament. He was also on the panel on sectoral investment in India and South Asia at Healthcare Business International at London. This is a little brief about Dr. Saxena. And for today's topic, Dr. Saxena will be discussing enabling positive patient experience through technology. Now I request Dr. Saxena to please begin the session. Thank you.
Thank you, Gautam. Thank you for that introduction. And I would like to welcome all of you in this meet. I just wanted to briefly discuss in terms of what we have been discussing through with Gautam and the team for quite some time, and that's basically discussing on working on the various modalities in terms of what all is available right now. And what we have been able to see now is that a lot of technology work is going on in our areas, and that has started, entering into the healthcare sector also. And this has become, for many of the healthcare operators, it has started looking like as if they get pained by it because of the number of people who keep interacting. But unfortunately or fortunately, I see them as one of the good enablers who will be actually bringing a lot of positive patient experience, which definitely translates in terms of how the patient, and in coming times, the healthcare would be delivered to the people across. So I think let's start and get into the subject in terms of looking at how technology will be enabling positive patient experience. And what have been my experience up till now with most of the technology builders as well as the people who are coming and meeting us has been they have been thinking right in terms of the component of healthcare technology as the patient as the center point. And I think from a healthcare delivery perspective, we as clinicians sometimes miss that point a lot. And we build up systems which are more around the healthcare sector, how we perceive it, rather than how it's to be perceived by the patients per se. So if you look at from a patient, from that experience, I think patient experience is the sum total of all interactions a patient has with their system. And when I say experience is the sum total, it doesn't mean right just in terms of the clinical care. I mean, it's right from the point of the moment you get off your vehicle, or even before that, how you interact with the healthcare system. Prior to that, you go online, you check with the place, you check on the reviews, you check on the various aspects in terms of it could be billing, it could be booking your appointment, it could be getting a review about your doctor, about your healthcare unit, and about the outcomes of your clinical care. And I think those are some of the key areas which actually become very, very important when you're looking at it. So for us, what matters? It's basically when we have done in feedbacks, when you talk to patients, they have always found that staff friendliness and facility conditions are very, very important apart from the recovery bit. And in fact, at some places, it has been found that staff friendliness and facility conditions scored higher than the recovery. And I'm not saying that the clinical care takes a second seat. It's basically the overall, the whole scenario in terms of the whole healthcare delivery, the whole ambience, the whole ecosystem matters a lot. Uh, the patient have been talking about ease of scheduling appointments, the availability of information, communication, etc. But I think the customer service experience is what actually determine, and that's where we start getting low scores in healthcare. So they would have been extremely happy with the appointments or the other areas in terms of clinical staff responsiveness. But then the customer service experience, which could be related with communication, which could be related with how their whole experience of getting information, could be one of the biggest things. And I think the area where we lack maybe in the area of the skill set, where it could be with our electronic health records, where it could be our communication, internal communication, where the patients invariably end up as the people who are the scapegoats who bear the brunt of a poor communication system or knowledge pool which is being shared. Uh, Across my years, 22 years in my experience, I've always found discharge being the pain point. And I think many of you who have been in this industry and have been interacting with us, you would have also complained about this, that the discharge process and insurance interactions are some of the places where we really score very low marks. And that actually ruins the whole experience. And when usually you come across patients who would be talking to you and telling you, well, when we go to a mall or where we go to any other place, the checkout is so smooth. Well, the checkout was so smooth because you are aware of the price points. Unfortunately, in healthcare, there is a lack of price transparency. And you don't know whether your bill is going to end up at that amount or not, or will it overshoot? Or do you have a copay? Do you have a certain areas where are non-medical consumables you will have to end up paying? Where even though if you are having an insurance, there will be a certain component which you will have to bear. So I think that's one where it's lack of knowledge or lack of transparency or lack of clarity from either sides. And of course, the other is the underdeveloped payment gateways, where you are talking about insurance. An average insurance procedures can take between 4 to 8 hours, depending where you are and which hospital you are or what surgery you have done. Typically, you will get, when you get hospitalized, a clinic in a cash or credit system. In a credit system, they would say that you have an approval and then the final approval comes and there could be a certain change in the amount or it can be fully passed. But the whole process of filing for approval takes about 3 to 4 hours, and that invariably delays. And a patient, when he comes to the hospital, he doesn't come by choice. He has to come there because he's undergoing a certain amount, either a surgery or he's a certain amount of discomfort in his life. But when you're leaving, you are an utmost emergency to leave this place, and no one wants to stay in a hospital, believe me. Uh, And patient cannot distinguish, is it between the faulty technology or is it because of the hospital workers? Most of the times we end up getting complaints where they said, your people have not filed the forms properly, or your people have been unable to fill in the right information, or they have not filled it in time. And as a result of which, I'm bearing the brunt of this. I think when you look at this, what matters is from a hospital or a healthcare and a patient's point of view is that 92% of the people feel that patient experience has to be the top strategy for a hospital. And as I said, it doesn't mean just focusing on his treatment. It has to be on every touch point, right? From his entrance, on how he comes and talks to you in terms of how he touch bases with the system, to the point of where he's leaving the system. And when we looked at it, there's a clinical quality indicator, which we talk about. And when BMJ, it's a British medical journal, when they do a quality and safety journal, they found that communication in higher patient satisfaction usually results in decreasing of rehospitalization by about 35 to 40%. And that's very, very important. And this communication is not between the patients itself alone. It also moves on between the doctor and the patient. It can be between the doctor and the nurse. It can be between the healthcare providers among themselves. When you look at the patient in the current times, you already start looking at how the patients are interacting. And post-COVID, I've seen a huge amount of surge in patients whose attitude and approach towards technology has changed. Prior to that, of course, there was a bit of hesitancy, I would say. They were not very, very comfortable using technology as a kind of a front foot or a first option. But lately, post-COVID, there has been a huge number of people who are now on the healthcare platforms seeking for medical advices, seeking for medical consultations for their ailments. And they have become more savvy also. As a result of which, they are looking at advanced technology platforms which can help them to not only engage with their doctors, but also they can share their medical data on that. As a result of which, IoTs and engagement technology data points have become very, very useful. If you look at Amazon, see, in terms of Amazon, you don't have to call up anyone. You can actually be online and still be able to give a phenomenal customer service to your patient or to your customer. They can actually order, they can refund, they can talk about it. And I agree that in terms of healthcare, it cannot be a commodity in terms of the needs which comes to a site like an Amazon. But then when it comes to a medical consultation, they would definitely appreciate something as a benchmark in healthcare in a patient service experience. So what do we talk about? Are we talking about a good patient experience and how we can improve upon it? So we use balance measures, which is basically many of these indices, which we use as length of stay. And there have been studies in terms of when medical insurance teams came on board, they said health insurance is actually going to put a certain timeline. So you can be there for 2 days or 3 days for a surgery. Interestingly, in US, this started happening where they had made 3 days of post-op labor stay as the maximum amount permissible. And beyond third day, they would start charging you. And that would be falling out of your insurance scheme and the patient has to bear the cost. So invariably, the trend started where they were pushing out patients at the end of the second or third day because the insurance was not covering up and patient was unable to afford that much amount. And this resulted in a lot of discomfort to the patient, where people have started saying that we are not comfortable with this. In the current scenario, I think it becomes very, very important that if the focus point is customer, if the patient is your focus point and his care and his needs are the focus, then definitely you will have to look at not only the length of stay, but you also have to feel in terms of the negative impact it will create on the patient experience. As a result, I think patient satisfaction surveys can serve as a meaningful way to identify these gaps. And then based on this, you can improve upon your quality. And then, of course, it comes into your reviews, which are online, maybe through Google reviews, maybe through various platforms which are available on the line. The other bit is the care teams, which we are talking about, and not individual care providers. So most of the questions is how did your nurse, which we ask in our feedback systems, or the doctors would ask you, how did your nurse do? How did your physician do? I think it's very important to talk about how was the whole clinical path in terms of the team. Did you find that there was a disjoint between the communication, or they were very well coordinated when they were interacting with each other? Because many a times I've seen the nurse coming in and saying, and the patient asking her, am I supposed to take this medicine? Because the doctor told me it's over, this dose is over, I'm not going to continue with this. And the nurse will say, okay, ma'am, I'll come back. And this anyway immediately puts the patient in a place where he or she feels that, oh my God, I might be overdrugged, or I might be getting a wrong medication. So that becomes very, very important. And I've seen this in a smaller setups. At times, these things are very, very cohesive, whereas in bigger setups, at times you miss these things. But at the end of the day, it becomes very important that the care teams themselves should be in sync and should be talking. And there, of course, I would say the technology plays a very, very major part, which I'm going to talk about in the coming slides. Employee engagement is something where where the hospitals and healthcare units need to typically, focus upon, because it says that it helps you to communicate better. It helps you also to relieve of the kind of focus you have in terms of stress, and it helps you to focus more on patients, less on the other aspects, which actually pulls you down in your output. And I think the most important part, which is coming down for conversation, is the healthcare analytics, where we are talking about the use of analytics to understand the data and how we can use this data to actually look at our work. So we can use new ways to determine how data is, that will help physicians to ascertain major adverse events. So I can see data how, and it can be across any of the portable devices, which can be handheld, and I can actually see how my patient is going to fare post-operatively. I can also look at in terms of the experience. We also have these in terms of when we are talking to patients, when we are looking at, when they invariably end up looking at some of the outcomes with these patients. And when we look at their cases, we find that not only the medical errors come down, there's also areas where we can actually withhold certain areas, like maybe any questions or any queries which are coming up from the customers or the patient, that themselves can be then put on hold with that, with this kind of service prior. And the last bit is with the innovative technology. I think interactive tools which improve the wayfinding and reduce stress for patient and visitors, these are something very, very important. So you can have communication devices, electronic patient feedback systems. I think in the current scenarios, we are looking at smart rooms. We are talking about interactive education systems where patients can actually be told about themselves, especially the smart rooms where patients can actually go around, and it's basically areas where they actually can control the environment around them. If you look at how technology is being used, so in Nationwide Children's Hospital Organization, where I'm going to share the slide with you, is where you've seen that they have adopted virtual VR technology to improve patient experience for children. And what happens here is that when the children are coming here, this is a child who was undergoing thalassemia treatment, and the mother herself is a nurse. She's been complaining about how when they're putting needles into this, the child is extremely fidgety, he's very, very anxious, nervous, and this can also result in a child, hurting himself. When you're putting needle and when you keep moving around, you can hurt yourself. Though a mother herself being a nurse, she felt that it was a great challenge in terms of how to handle the child. So what they did in this Nationwide Children's Hospital, for these children are thalassemia patients and they keep coming up regularly. So they sat around and the doctors and the team thought about it, and they got a real VR mode established for them. And which is a very interesting thing, because this is being controlled not by hand or so through your head movement and through your breath. You can actually control the images as well as interact with the what's going over there. So there can be interactive series which are running there, which can be animated features, or it could be something which the child is learning and he's enjoying himself. At the same time, you put the patient at ease. And this is a very, very cheap device. It's basically using cardboards. And here you can see the patient, the child is being easily, they're putting up a line there. And this time he didn't even wince. He was so engrossed in his area and this. And in fact, it has such an interesting feature, because when you're suspecting the child might move, you immediately increase the sensitivity of the VR. You can decrease the sensitivity of the VR. So it's very, very interesting, because you're using technology not only to assuage the patient, but overall the experience has been great. The mother has been singing praises about it, because now the child doesn't have the same kind of anxiousness or fearful of going to the hospital. His experience is extremely good. For me, as a service provider, as a hospital, I find this far more faster and safer, unfortunately, which was not happening in an earlier time. You all have been aware of technology in terms of appointment reminders. We recently got a spate of these reminders apps which have been built. The hospitals are using them as their individual apps. They're also using it through your personalized services, through your reminders, calls. We do it for digital consent forms. We don't have to, you can send the patient prior to that and he can read it and he can come and just sign it. Similarly, for care plans, right from continuum of care, which the hospitals do, right from the point of admission to discharge and what is to be followed post-discharge can all be done on a health management tool. And these can be uploaded to an app and the patient can follow it. We already see this in diabetic patients where you are seeing not only their doses are being continuously monitored and catered to, they're also looking at in terms of what are the outcomes. There are new apps being developed which can actually do your real-time BP measurement, your SpO2 measurement. And if you remember during COVID times, we were actually using some of these technologies, especially for oxygen saturation levels, to understand whether this was working up to the mark or not, and how was the patient faring. At that point of time, if you all remember, we were running short of beds, we were running short of oxygen, and then people were actually looking at who were the right kind of patients who needed their hospitalization. And those were the kind of screening tools which were developed, where in-house the patient could assess whether he needs to be hospitalized or not. We have these self-service kiosks in many of these hospitals which are put up where you go down and then check yourself in. You can actually look at what you need to do. You have, I'm sure you would have heard of Swasthya State. It is being used as a technology tool in the in the northern part of India, and more in the hilly regions where they have been able to see that ASHA workers who are not able to reach patients, but through on the basis of connectivity through satellite linkages, a patient in remote areas can be actually monitored for their hemoglobin levels, for a mother to give to give birth to a safe in a safe environment. The child's hemoglobin is being monitored. The mother's hemoglobin is monitored, so a safe and a healthy child can take birth. And this is all being done remotely. The doctor would be sitting in one part of this clinic while the mother could be in a remote area elsewhere in the same region. And they are still able to talk, and the ANM can go there on a regular basis, and she checks it on once a week basis or once in a fortnight, hemoglobin, urine albumin, and then she gives an intervention. And once you're giving an intervention, you can start monitoring the intervention by making sure that the iron and folic acid is being given to her. She is every day she's noting it down and she's punching in the number on the system, and as a result of which you can actually get a better improvement from your outcome purposes. We all have been talking about big data, where we are talking about the numbers which are coming in and which have started showing us results. If you look at the Indian current data, we all have been aware that the Indian fertility rates have been falling down. And at one point of time, when we were looking at by 2030, we would be actually coming to a plateau phase. I think in past 5-6 years, the data which have, in past 2-3 years, the data which has come, fertility rate has dropped more drastically. So by 2025, the Indian fertility rate would almost be stabilizing. As a result, the growth will almost be coming to a stagnant phase. And then we will go till 2050, 60, and then we'll start dropping. So this is the kind of number crunching. And then when this data is coming in, we are also looking at what kind of population is coming, what generation of people we are going to see. There will be a larger population shift or demographic shift towards the right-hand side, which will be a higher aged individuals, and that would also prepare us for a different set of diseases which needs to be focused on, as a result of which we are seeing hospitals or healthcare units slowly gravitating towards that side of solutions, where they will prepare for people with those kind of needs. Of course, we are looking at, when we are looking at this, this also helps to reduce cost, because a patient's cost economically also coming down to hospital for checkups gets highly reduced. We saw during COVID times, patients were not moving around, but then online consultations were a big boom that point of time. And till now, that has become as a kind of, as a habit among the patients. So now at earlier point, which was a necessity, has now become a norm, where patients can now go online consultations and do this because it's been acceptable. Similarly, for how cloud-based services, where you can upload your X-ray films, your CT scans and MRIs, and then you can move around everywhere. Earlier, People used to carry bundles and loads of papers when they were moving from one center to the other, because there has been a aggregation of higher goods centers in metros. But now with this, the cloud-based service, you can actually move around uh, to a goods center or higher center without these challenges. On the other hand, with uh, consultations which are coming through online, you are also observing that a good quality of healthcare is now being made available in tier 2 towns, tier 3 towns also. So I think overall there is the technology has been creating a level playing field where we are seeing a lot of good work happening at all levels, and also it has become so patient centric where a patient is at ease and he can then take a call in terms of how he wants to move forward. If you look at this, I think one of the best examples is from Disney, where the focus has always been the guest's experiences, and it doesn't come from one person; it comes right across. It comes from right from the CEO to the all the employees, where they say that culturally and philosophically, all decisions should flow from the patient, and it should balance between the business and the financial goals. So then what do we understand from a healthcare delivery perspective? I think what we need to be very focused about as healthcare providers is that we should not be presuming to know what patient wants. I think we need to find out who the patient is, what does he want and what his needs are, and what are we supposed to do to meet them. And if you see the current spate of new technology based surgical uh, solutions which are coming up, where people are talking about right from patient can determine which doctor to see, and once that is done, there are healthcare service providers. We are talking about not only taking care of your right from pick up from your home to your surgical and back home. They will do the whole thing, followed by post-op follow-ups from the nurses, healthcare workers. So the patient at the end of the day is now getting the feeling of being taken care of, a 24/7 commitment coming up from the new technology platforms which are providing these solutions. As a result of which, what we are seeing is that it's turning into a patient-driven insight and centricity. And as a result of which, this is what is creating a lot of changes in the current healthcare industry scenario. We are talking about a lot of uh, inefficiencies which are moving out, especially related to time factor. Patients can now go and online and check on the doctors. They can actually schedule themselves in a far more efficient manner without losing their work time. They can, or without losing their personal times. They can also be aware of in those scenarios on what are the clinical outcomes and what are the overall experiences, because these platforms are also providing you with the outcomes. They are also providing you the other experiences of their peer. How have they experienced the places and how they have seen the services? I think from a provider's point of view, we have to relook at our whole healthcare delivery system, where we are talking about saying that patient has to be the centric bit who will be the center of all these changes which are happening around him. The whole healthcare system needs to be built up, and we have to create the healthcare in terms of provisioning of healthcare around the patient, and that's where the competitive advantage would be. And the provider who will actually facilitate this would actually end up being the so-called true winner, who can actually look at developing a right kind of strategy for the patient. Of course, this is not to discount in terms of clinical competence. This is not to discount in terms of service delivery purposes. Clinical outcome is primarily what the patient is there for, but none of them can actually supersede or underplay that. But these both of them have to go hand in hand to actually provide the right kind of solution for the patients in coming times. Thank you very much for your time, and I'm open to any questions if they are available there. Yeah, I think there are a few questions there. So,
thank you, Dr. Saxena. Fabulous. I'll just move on to the questions for you. First question coming from Rakesh Malik. He's asking, what are the challenges small and rural hospitals face in technology adoption? How can these be overcome?
So, Rakesh, I think some of the challenges which small and rural hospitals are facing in technology bit is, first of all, the accessibility or in terms of getting connections per se. I think the rural areas, despite some of the areas being very well connected now, they still have challenges in terms of getting a good bandwidth. The other bit is still continuous competency is being a challenge there. But I think what technology has been able to do, and I said during COVID times and during my conversations also, that during COVID times, a lot of these challenges were overcome. Uh, Now, I think even the remotest areas of India are very well connected with a 2G or a 3G network. So that comes over, and the consultations have been overcome largely. In terms of competence, yes, I think there are challenges there because of the viability of a good clinical center being established there. And that's not because of the clinicians per se, but also about the healthcare delivery infrastructure. So you may not be finding maybe a good hospital, but I think if you see the current investments which are coming in healthcare through private equity partners and private partners, there is a trending where tier two and tier three towns have started seeing mushrooming of good quality care hospitals being established there. These are low cost, affordable models, which again, as I said, are more patient centric. And that's where it is happening. I think there will be some time before the fourth rung, which is almost like you're talking about at a panchayat level, we are able to see that that might take some time, but already I think tier two, tier three towns are seeing some good private hospitals coming up and providing healthcare there.
Fabulous. Thank you. I'll move on to the next one by Akshay Gupta. He's asking, please share key health technologies that boost patient experience and satisfaction. If you
Yeah, Akshay, I think I mentioned Health Slate. Swasthya Slate is one which has done pretty well. There are a lot of, I think, private entrepreneurs online who you can check, and there is, I think, quite a number of them who have come on board and improved healthcare outcomes. So, interestingly, their platforms work on a couple of ideology points, which would be like, how does a new, if a hospital is being onboarded into these platforms, they look at, they rank us based on a clinical competence and outcomes, and that's the same which is conveyed to the patient, to the customer or the patient. So he can then pick and choose in terms of which hospital. So it could be through geographic location where he can come through. He can come through other. It could be price points. But I think these are the ones how technology is enabling. Of course, the other bit is where self-serving kiosks are there, where people are going there and started, checking themselves, especially for your blood sugar. I think Apollo ran a program earlier this, and then there was now you have seen a lot of these other delivery platforms coming, healthcare delivery platforms. I don't want to name them, but I think you can check on quite a number of them who are talking about end-to-end delivery care online, which take up the patient right from his case from at his home. You can book an appointment, see the doctor, come back. They will help you to come to a price point which will be whether covered under insurance or not. They will guide you through that and then guide you through a surgery, post-op care, followed by nursing care for your post-op surgical toileting as well as for your dressings, etc. So I think there are a lot of multiple end-to-end platforms which have been created, which create a huge amount of value, not only from a customer's point of view, but also from hospital delivery point of view, because it helps and eases our work. So hospitals are also very, very interested in terms of seeing what they can learn or what they can contribute through these platforms to the patient.
True, very true. I'll move on to the last question.
I think that's a very interesting question. It's a very interesting question. It says about how can preventive care be enhanced with technology, and I think if you were part of this and you mentioned, if you would have listened, I mentioned about Swasthya State. It was done by Parivar Seva Sansthan, and I think Kanav Kaul was the one who started this. And I'm talking about this way back in 2011-12 when Kanav actually provided that, and I still quote it as because at that point of time in India it was not visualized that you could have something like that. And he started using this. So if you look at his laptop bags, which he's provided with his healthcare providers, they are working. It has been given to ASHA workers or healthcare workers. And these backpacks have actually one side is solar cell panel. So this, and inside is a dry chemistry, basically biochemistry, where you can do certain amount of tests. And the solar backpack cells help as batteries, which charge the biochemistry analyzer. And the nurses carry them on their backs when they're in the hilly region or the terrain. They go to these remote areas because when you are in these it's been done mainly in Jammu Kashmir and area where Kupwara and these places where they found that in hilly region they had a high amount of maternal mortality and infant mortality, and the mothers were not able to deliver. The children were dying very early, or the mothers were. We lost a lot of mothers during there, and that was mainly because of poor, partly hygiene and partly because of healthcare services like low hemoglobin, uh, BP was not being measured. So the healthcare workers were provided with this, and these backpacks had enough battery to not only to connect the biochemistry bit, so they would take the blood sample, test her, and then they would upload that, and it was connected through the satellite through the results. So she would immediately punch in through a smartphone or a mobile phone, whichever she was carrying, and the data used to be uploaded on in the same time on the inside or through the satellite, and the health center, which was around say 30 kilometers away, would receive the signals, and the doctor online would immediately see how the patient was and how he had fared from previous hemoglobin levels to now, and he could immediately put an intervention. And in fact, that data is a very interesting study where if you look at PSS study, they were able to bring down the maternal and mortality and infant mortality rates drastically in these areas. So I think this has been a great thing. You have seen a lot of this work happening now currently in sanitation areas where you are talking about potable water, and people have been able to provide more, you know, clean water drinking, and they have been able to provide solutions where they can check the how much, like whether you can that water is potable or not, and what is the level of clarity or what is the level of impurity or purity in that water, which will determine whether you can drink that water or not. And they also provide you solutions which are like you can drop a chlorine tablet, and after that you can again test it, and the test is done on the spot, so you know immediately that the water is potable and you can drink it. So I think from hygiene and the sanitation bit, there has been tremendous amount of work on this area, and this would definitely revolutionize the healthcare delivery models in India.
Thank you, Dr. Saxena. It was fabulous listening to you. If there are no more questions, we will end it for today. But I'm sure after this, if anyone comes up to me and asks me for any question, I'll surely reach out to you as well.
Sure.
And,
Definitely.
Thank you very much. Such an insightful and engaging session. Our guests and I have been hooked on till the end, and I've taken up several nuggets. And thank you to our leaders in the audience for joining us and for staying till the end as well.
Thank you very much for your time. Thanks a lot.
Bye.
Wish you all the best.